If there's a home improvement project that needs doing, you can bet Sue McMahon of Milan is the best person to get it done. You see, Sue loves working with wood almost as much as she loves working with people. Sue is a nurse who works at St. Joseph Mercy Hospital.
No, I'm in adult medical surgical nursing, and I like that.
Sue's entire life has been about medicine, so it's incredibly ironic that she would run head-on into a major medical billing problem, one that would cost her nearly $4,000.
So all of a sudden, this bill wasn't paid by anybody.
And how much was the bill?
$3,878.
It all started when Sue accidentally cut her index finger completely off while cutting a piece of wood on a table saw.
I was using the push block that everybody says is the appropriate way to use the table saw, but the block jumped the blade and then my hand went into the blade.
Now, because Sue has medical coverage through the Blue Care Network, she directed EMTs to rush her to the University of Michigan Hospital for treatment. Total cost, $3,878. The problem is, Sue actually has medical coverage through 4 different companies. The Blue Care Network, which is U of M, Priority Health, her employer, Medicare, and something called TRICARE. And unbeknownst to Sue, by going to the University of Michigan, she'd actually gone outside her primary network, which means she would have to pay that almost $4,000 bill.
Priority Health is primary, and you went out of network, and they're not paying it because they won't pay for any services that are rendered at the University of Michigan.
For 2 long years, Sue fought paying that bill, and finally, she called the Call for Action team. We negotiated with Priority Health, and just 3 weeks later, Sue's $3,878 medical bill had been paid in full by her insurance.
The team is just marvelous. Just marvelous.
I'm glad we could help you.
Yeah, I really appreciate it.
Now, do you know, before she called us, Sue even hired an attorney to get her out of this big billing mess. And for a year, the attorney worked on the case, and after a year, he failed to do anything. So Sue came to us, and we got it done. Remember, if you need help, call the Call for Action team at 248-827-3362, 248-827-3362. Call for action, and you get action.
Yeah.